qualifies a doctor to train as an aesthetic practitioner within a day of training? You know, I'm one of those people that campaign against beauty therapists injecting, because I believe they're not medically qualified and competent and skilled to face complicated situations that could occur. But what makes a dentist who does a 8-hour training course any more competent than a beauty therapist?
Or for that matter, a dermatologist or a plastic surgeon. Now, Atul and I, we went through the NHS plastic surgery training program. How many days, weeks, months of training did we have in aesthetic or non-surgical? None.
None. So you're no more qualified, even at the top of your profession as plastic surgeons, and medically qualified professionals, not having done any training, to be any more competent than a beauty therapist.
And even in the field of dermatology, when you go through the specialist registrar training, cosmetic dermatology is not something that is in the curriculum. So everyone and anyone who comes out of the training to be a plastic surgeon or a dermatologist has to retrain in the aesthetic industry. So again, it goes back to the same point that you highlighted, which is it is a day's training or 2 days training.
Does that not worry you? Do you know, when you actually, if any of you have had aesthetic treatments, would you ever bother asking your doctor how many hours training he's done? No, you don't. You don't. Should we? Should we be asking?
Absolutely.
Sorry, I do. You do. Well, I know they're going to be good because I know who to go to, but at the same time, you've got to educate people. Sometimes are intimidated by going to aesthetic practitioners, and they don't want to ask as well. They're a bit scared of it.
So what should we be asking as members of the public when we come to you? Because this is the problem, okay? We're a bit too scared to ask. A lot of members of the public are afraid of the medical profession because, you know, you have someone with respectable authority in front of you. Should we really be asking how many hours you've trained, how many days you've trained? Is it our right to do that? And how should we be asking? Apple?
Thanks. Yeah, it's fascinating to see that as we transition from NHS to private practice. I see a lot of patients coming in who have this sort of, I think, slightly outdated respect of holding doctors somewhere up in the air, and we're simply coming in and asking us for a treatment and not necessarily asking about qualifications. And I certainly think within the industry, the leading doctors, dermatologists, surgeons are encouraging that discussion. I certainly tell my patients, well, thank you for coming. Now, before I even start, let me tell you what I've done in terms of my training, where I've trained, how many years I've trained for, how many training courses I've taught on, what feedback I've received, what changes I've made in my own training, before I then be ready to train other people. So I encourage patients to ask, and I strongly tell them, I said, you know, even if I never see you again, I want you to go out there and ask your future doctors, future surgeons, wherever you go, what the qualifications are. And I encourage them that we must do that. At the end of the day, if things go wrong, it is that patient's face, that patient's heart, the body, and they should respect that and remember that. So I really encourage open conversations and debate. And I think the GMC's also increased awareness around consent process, which is again a very, very important thing, which I think personally wasn't emphasised enough in the here before. And by taking informed consent, patients now are fully aware, or should be, of what potential complications can happen, and if they do, what options are there